Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, we're talking all about our Gold Neonatal Conference. It's coming up really soon, friends. It's our 2025 year, and it's just incredible to have so many people coming back, registering. And I'm excited because this content this year is definitely going to take your practice to a whole new level. We're absolutely delighted to have back here with us Dr. Jennifer Barnes. She's back here at Gold. Very popular because the topics that you bring to us, Jennifer, are just fantastic. And this one is not going to disappoint. And I think that when I first saw it come through, I just thought, oh my gosh, this is really going to, turn heads, I think, a little bit. So I'm going to tell everybody what they're going to be listening to. No chopped liver, parenteral nutrition associated liver disease in infancy. So welcome back to Gold. It's great to have you here today.
Thank you so much for having me. It's such a pleasure that this is my fourth time speaking for the Gold
Yay.
Neonatal Conference. And so much, thank you guys so much for having me back. And I'm just really excited to, spread the knowledge and talk more about parental nutrition associated liver disease and what are ways to prevent, and also like what are ways to like best optimize and treat once babies do have it.
Yeah, absolutely. Yeah, these sort of details, as we would say, become so important long term, in preventative medicine. So it's exciting that you're going to be able to showcase some of this. And I've already had a bit of an inside scoop into your presentation. And let me tell you, it is detailed, everybody. Um, so get ready, definitely. So the exciting news is, though, you're going to be with us this year live, which means that you'll not only you'll be there live during the presentation. It will be recorded, so folks who are listening in
Mhm.
today, if you're wondering, you will be able to listen to the recording, and then of course you and I'll have a chance to do a live Q&A with the audience that's there on site as well, which is going to be a lot of fun too, because we can really take a lot of people's questions that day too. But let's get into,
Mhm.
I've got some questions for you, of course.
Yeah.
Just wanting to sort of understand the framework here. What are we dealing with? What's happening? So, but let me ask you again, what really drew you to this topic? It seems that, parenteral nutrition and liver disease, I haven't heard it being talked
Mhm.
about very often. So tell me, how did it come up for you, and, how did you land here?
Yeah, well, I think I always try to touch on a different portion of neonatology every time I do present. So really, this was a part of it, and I think this is something that's come out of patient cases where we've really seen the morbidity and even
Mm,
mortality that can happen when parental nutrition is a life-saving aspect, and so many of these babies do receive PN because they aren't able to digest food via their GI tracts, and so
right.
it's life-saving to have it. But then those babies that aren't able to eat enterally then end up on these long-term TPN, and they have this
Mhm.
complication. And so this is probably the most common complication of long-term TPN. And so I think this is one of those things where just kind of talking about the nuances and what are ways that we can prevent it, but also how to best treat it once babies do have it, and just optimize their care. And so I think just in my own personal professional career, just seeing this happen within the NICU and doing some literature research. We at our own institution last year rolled out a lipid guideline on
Okay.
which lipids necessarily to recommend based on different babies. Um, their clinical status. And so I think this kind of rolled out of that this is a very great, interesting topic that while and it really will touch whether you're a level 4 NICU, whether level 3, it will touch many different NICUs that take care of babies long term.
Yeah, no, absolutely. And I think it's great because one of the things I've said to you before, and you might have remembered, Jenny, is the fact that I love your interpretation of the research. I think sometimes it's really hard to go through all the literature, and then have to translate it into, understanding and knowledge. You're just really good at it. So I appreciate that, you do that for us. That language interpretation really helps, also just get to the facts. You know what I mean? Like, let's just
Mhm.
get to what we need to do next as well. So tell me a little bit about, in the NICU and the staff, what do you wish that NICU staff really understood more about penile in totality?
Yes. So of course I will we do because I am a pharmacist. We do talk about lipid therapy as well as different medications. However, even outside of the pharmacologic aspects of it, there are so many things that your bedside staff can do. It's
Mm,
preventing infections. Infection is a major cause necessarily for the worsening of and development of what we call PNOW, parental nutrition associated liver disease. So it can be from things of preventing infections, but then also advocating for what are the best ways, best lipids and parental nutrition components to give in these babies that are on this TPN long term. So I think it can, go from doing our best to prevent infections to, um, therapy to advocating for compatibility so that we're able to give
right.
some of these lipid therapies with their other medications as well that are unrelated to parental nutrition. So I think there's lots of things that our bedside staff can do, as well as our providers and other medical professionals as well.
Yeah, absolutely. I love that part where we can all advocate. We can sometimes know if you're at bedside, you can notice things that other people haven't. So yeah, it can become part of our sort of daily practice as well. You mentioned talking under knowing and understand lipids, compatibilities, and all those types of things. Can you tell me, and in fact, you had told me a little bit about your, what you've done on site at your own practice there. So can you tell me, are there new lipid therapies or strategies that you're particularly excited about?
Yes. So part of it has also been we've really had an explosion. For 30, 40 years, there was really only soy-based lipids available here in the
Mm,
United States. And so there was you could do through investigational drug services to get into fish oil-based or a megaven is what we commonly call it. But that was really hard. If you weren't a part of a major medical center that did research studies, you didn't
right.
necessarily have that available.
Mm,
And so then SMOF or the mixed oils came out, and so that really revolutionized. And I think there was a ton of literature that came out from different various countries, and so it became, well, which ones should we use in which instances? And
right.
truly, what I go through a little bit is probably for short-term use. Whether you use soy-based or a mixed base doesn't necessarily matter, but there is really data to support that mixed oil base for a variety of different reasons that decrease that inflammation for that liver.
Right.
If you're using those mixed oils, which we have, is called SMOF lipid within the United States. Um, but there's even new types. There's clinolipid just got approved for pediatrics and neonates here in the United States in last year, and so I think there's new emerging methodologies that are happening
Right.
and that didn't necessarily exist before all this, or that wasn't at least available here. And so I think as more new products come out, really digging through the literature to say where's the support,
Right.
what is the overlying body of lit support, and what are best ways that we can implement this into our facilities, especially like I'll say within even our own healthcare system. At where I work, we're now 69 hospitals, not 69 children's hospitals, but then making it where we have all options available, whether you are a small, level two NICU, or you're one of the level four more acute care NICUs available, that we have products that children are able to get what they need no matter where they're housed.
Oh, that's incredible. Well, I mean, it's just wonderful, really, that we're starting to see choices, and it'll be
Mhm.
interesting to hear actually, Jenny, when we're working with folks live at the conference, I would love to hear, what others are doing around the world, what sort of approval they've gotten recently
Mhm.
too, hoping that, they've also got some good choices coming their way. But I'm sure they'll be interested to see what you've been able to utilize at your hospitals as well. Well, thank you so much. My goodness, there's always more to ask, and here we are, just at the top of the hour, just wrapping things up here. Thank you again for being here. Before I let you go, I know that there's a lot of moving parts all the time in our NICUs, but Is there anything, any small change that you would love to see NICUs, do just to reduce the risks of penals in practice?
Yes, I mean, there's definitely several different things I think that we really can. I think from like the bedside nurse, I would love, that really active conversation about if you see a change in stool color, really having and doing more
Mm,
lab so that we're catching these babies early on
sure.
to those babies that are on long-term TPN, maybe switching our lipid utilization to more that mixed, less inflammatory, um, SMOF example, to really optimizing ones that patients that do develop PNOD, not necessarily continuing on with the SMOF, but switching over to that fish oil base Omegavin, which is
Mm,
really the most beneficial from a treatment standpoint, not so
yeah.
much prevention, but for treatment. And so, really helping utilize that option for those patients that do qualify.
Yeah, absolutely. Yeah, prevention is definitely the key. There's no doubt about it. Well, thank you so much for being here today, Jenny. It's been lovely having you back here, sitting
Yes.
down and chatting with you. And of course, coming up with your presentation at Gold Neonatal, No Chopped Liver, Parenteral
Mm.
Nutrition Associated with Liver Disease in Infancy by Dr. Jennifer Barnes. You can see it live at goldneonatal.com. You can head over to the website right now and register not only for Jenny's presentation, but of course, all of our other Gold Neonatal presentations coming up here. Goldneonatal.com is where you want to go right now to capture all the content that's coming up. We'll look forward to seeing you online. Thank you again for being here today, Jenny, and we'll see you all very soon. Bye bye for now, everyone.
Thanks so much. Please join live.